Okay, state your name.
Geraldine Hayden.
Okay, Jerry, how are you today?
I'm good.
Okay. Uh, I see that you came in today for a general head and neck survey.
Yes.
Okay. We're going to just begin with some general questions. If you have any questions or feel uncomfortable with any way during the survey, just let me know.
Okay.
Okay. Can you state your age?
60.
Can you state the president? Can you tell me the president of the United States?
Joe Biden.
Can you tell me the former president of the United
Donald
States?
Trump.
Do you know what today the day of the week is?
September 15, 2021.
Okay. Do you have access to 3 meals a day?
Yes.
I noticed when you came in that your mobility was straight. You wasn't using any assistive devices, any canes or walkers. Do you use any of those devices?
No.
I noticed that your posture was straight and in alignment. You didn't have any deformities or any abnormalities. Do you have any of those?
No.
You're not. Your BMI is accurate for your height and your weight, which is excellent. I'm going to begin with the survey. If you feel uncomfortable in any way, just let me know. Okay, I'm going to sanitize my hands, and then I'm going to do privacy. Okay, and I'm going to start with your cranium, and basically what I'm looking for is the bumps or bruises. I noticed that your hair is a dark black and gray. I don't see any redness or infiltrations. I'm going to palpate. Does it feel any tenderness as I'm doing that?
No.
Okay. I'm going to move down to your face, and I'm going to do your sinuses. I'm going to begin with your frontal sinus. Any tenderness as I'm doing that?
No.
I'm going to move to your maxillary sinuses. Is there any tenderness as I'm doing that?
No.
Okay. I'm going to move on to your eyebrows, your eyelashes, and your eyelids. You can close your eyes for me. I don't see any drainage. I don't see any swelling or any infiltration. You can open your eyes for me. I'm going to move down to your nose, which I see your nose is symmetrical and in line. I don't see any swelling, any drainage, or any infiltration or redness. I'm going to move down to your lips. Your lips doesn't have any drooping. They're pink, moist, without any drooping. I'm going to test your reaction to light of your pupils. All I need you to do is stare to the wall behind me. I'm going to test it. Your right eye first, and then I'm going to move to your left eye. Okay, very good. I'm going to test your accommodation of your eyes. Just stare straight to the wall. I'm going to place the pen light in front of your face. You're going to move your eyes and not your head. Okay, that's excellent. Great accommodation. What I'm noticing, I'm going to move to your ears. I notice that your ears are symmetrical and within line. I notice that you don't have any redness, swelling, drainage, or infiltration. I notice on your right side you don't have any redness, drainage, infiltration, or swelling to the ear. Okay, I'm going to move on to your lymph nodes. I'm going to palpate all 10 lymph nodes. As I'm palpating, just let me know if you have any tenderness to the lymph nodes, or if you feel uncomfortable with in any way. Okay.
Okay.
Alrighty. I noticed that your trachea is midline and symmetrical. I wanted to point that out before I move to your lymph nodes. So now I'm going to palpate all 10 lymph nodes. Right here is your preauricular. Turn your head to the left. Alright, turn your head to the right. And I'm rolling my balls with my fingers. Okay, I'm going to move to your post-auricular. Turn your head to the right. Okay. Turn your head to the left. Okay. I need you to turn around so I can palpate the back, which is the occipital. Is it any tenderness right here?
No.
Okay. Alright, you can turn back around. Okay. I'm going to palpate right here. This is your gustodigastric. Turn to the right. Is there any tenderness or anything as I'm palpating it? Turn to the left. Any tenderness?
No.
Okay. I'm going to move here. This is your submandibular. Can you turn to the right? Is there any tenderness as I'm palpating?
No.
Okay. Turn to the other side. All right. Okay. Right here is your submantle. Is there any tenderness as I'm doing that?
No.
All right. Can you turn around again for me? All right. I'm going to palpate. Turn around a little bit for me. I'm going to palpate right here. This is your posterior cervical. Is there any tenderness as I'm palpating that?
No.
Okay. Turn back to the front, please. Right here, on both sides of the neck, is the superficial cervical. Turn to the right. Is there any tenderness as I'm palpating that?
No.
Turn to the other side, please. Okay. I'm going to go to your deep tissue cervical, which is right here on each side of the trachea. Is there any tenderness as I'm palpating that? You can turn to the right, please. All right. Turn to the left. Okay. Any tenderness?
No.
Okay. Okay. I'm going to palpate your thyroid, which I'm going to do it from the back of you. Can you turn to your left? And I just need you, just kind of turn your head to the left. Okay, I just need you to kind of tilt your head a little bit, and I just need you to swallow as I'm palpating. Any tenderness as I'm doing that?
No.
Okay, turn to the other side. Is there any tenderness? Swallow for me. Is there any tenderness as I'm doing that?
No.
Okay. Okay. Thank you, Ms. Hagan. That's going to conclude our general head and neck survey. Do you have any questions?
No.
All right. Thank you.
You won't.
Okay, I'm going to give a report on a general head and neck survey that I just completed on a 60-year-old black female. We begun the survey with basically some general questions. Basically, the questions were to state her name, age, if she knew what the day of the week it was, and she acknowledged that she knew. I asked her who was the president of the United States, who was the former president of the United States. I asked her if she used any walkers, canes, or assistive devices, which she denied that she did. I noticed that she didn't have any abnormalities, deformities as she walked in. Her mobility was straight and symmetrical. I also asked her if she was able to be accommodated with 3 meals a day, which she was able to have access to 3 meals a day. I also her BMI, which is her body mass index, was appropriate for her height and her weight. Then I moved on to the assessment, which I started at the cranium. The cranium was cephalic without any bumps, lumps, bruises, any redness or infiltration. Upon no tenderness noted upon palpation. I moved to the face, which I palpated the frontal sinus. No tenderness noted. I moved down to the maxillary sinus. No tenderness upon palpation. Following that, I moved to the eyes, eyelids, and the eyelashes. I had her to close her eyes, which no drainage, no redness, no infiltration, no swelling was noted. I moved down to her nose. Her nose was symmetrical, no swelling, no drainage, no infiltration. I moved down to her lips. Her lips was moist, no drooping, no swelling, no drainage. I moved to her ears. Her ears was symmetrical, bilateral, no swelling, drainage, or infiltration, bilateral noted. Her trachea was symmetrical, midline. Then I palpated all 10 nodules. Uh, all 10 nodules were without tenderness noted, without enlargement, without swelling. Um, I palpated her thyroid. Her thyroid was without tenderness, without any palpation. I mean, without tenderness, without any swelling or enlargement. That concluded my neck and head and neck survey. Thank you.